Hey everyone, welcome back to Rush SPT. My name is Rush Hendricks, and this video will focus on communication. So a vague topic, a simple topic, but really getting into why you should be developing your skills as a communicator throughout your PT school experience. So just to really emphasize this point, I want to lay out a brief scenario. Say you're the most knowledgeable PT in the world. Say you went through your 7 years of PT education, but you're not an effective communicator. You can't efficiently communicate and interact with your patients or with the interprofessional team you're working with. You're not going to be an effective PT. You're not going to get good patient results if you can't convey your knowledge to your patients, to your peers. So that being said, what are some opportunities you have? When can you do this? When can you develop these skills? And how do you do it? First, let's talk about the vast amount of opportunities you have in PT school. Think about all the times you're working in a group, with your research projects, with your TBL groups if you're in a team-based learning program, with your interprofessional studies with other departments, service learning. The list goes on and on. All these times you're working with your peers, with other classmates. So you're working with these different people. They all come from different backgrounds. They have different personalities. They have different ways of communicating. So why not practice those communication skills with these people you're in such close contact with? So I really want to urge you to take advantage of this. Really take it upon yourself to practice getting your ideas out there. So really discussing your way of thinking, telling people your problem-solving process, how you interpret instructions for a project, how you came up with this answer, what you remember, what you reflected on from the lecture or lab materials to really answer this, or how that applies to your project that you're presenting. That being said, the next step is really, after you've explained your way of thinking, accepting the views of others. So you have to work with and interact with a multitude of personalities throughout your PT school. Whether you have an outspoken member of your team that is really upfront and outgoing with their ideas, but not so open to other people and their thoughts. With that situation, you really have to work on the dynamic and say, I understand what you're saying. What do you think about this? What do you think about my interpretation? And then put those two views together to really find something that works and come to a great consensus with the team. On the flip side of that, oftentimes you'll have someone that's soft-spoken, someone that is more introverted, and you really have to engage them to get their ideas out in the group, because you know that they may have studied more than anyone, a brilliant teammate, but doesn't feel comfortable in getting their ideas out in a group for the group's discussion. So interacting with different personalities is crucial and will be crucial, because those skills directly transfer to a clinical setting. When you are interacting and communicating with a healthcare team, with the physicians, with the nursing staff, and most importantly, with your patients themselves. If you can't communicate effectively, if they don't know what you're talking about, if you can't explain what this intervention does to address their functional limitation, to address why they're coming to see you, you're not going to be an effective therapist. You have to have that communication, so you have buy-in, so you have collaborative care with the healthcare team. So those are my thoughts on that, why communication is so important and how it plays a role into your clinical setting after you've been in the academic setting. So practice it now so you can really be at the forefront of healthcare and really on the front lines of great patient care when you get to the clinic. Any thoughts you have, as always, any other ways that you have of making communication work for you, let me know, and I'll see you again soon.